Welcome to Colorado State University's podcast, The Audit, where host Stacy Nick talks with CSU faculty about topics ranging from their latest research to current events.
When you're a parent, one of the worst daily decisions you have to make is what's for dinner. When you're tired after a long day, that one question can feel overwhelming. What's healthy? What's available? What will my kids actually eat? So maybe you decide tonight you're going out. Colorado State University researcher Megan Mueller studies the impact that restaurants and our food environment can have on our food choices and our health. An assistant professor in the Department of Food Science and Human Nutrition, Mueller recently published 2 studies looking at the impacts of dining out. Today, I'm talking with her to find out more about how the food choices of parents influence their children and where restaurant corporate social responsibility draws the line. You have 2 recently published studies that focus on dining out, our food choices, and also the restaurant industry's social responsibility when it comes to health issues. And so let's start with that last one. Your research found that while the majority of restaurants had some kind of corporate social responsibility statement on their webpage, most of those focused on philanthropic endeavors or sustainability measures, not health-related statements.
My colleagues and I were interested in understanding the landscape around corporate social responsibility in restaurants. And the motivation for that was actually a study I had read in graduate school that was looking at how industry professionals, food industry professionals, were talking about their responsibility in the obesity epidemic in news media and other sources of media. And they found that basically the food industry shifted the conversation and how they've been talking about their role in health and specifically in obesity to be focused more on wanting to be part of the solution. So initially in the early 2000s, a lot of interviews with food industry professionals, coverage of the food industry in the media, the way that those professionals or representatives were talking about their role was more, it's not my problem, it's a personal responsibility thing, people just need to eat better and exercise better. And that shifted in the better part of 10 years, basically a decade. So around 2010, 2015, the industry shifted in how they started talking about their role to be more part of the solution. So they wanted to, instead of just blaming people for the outcomes that they were experiencing, they wanted to be a part of the solution. And who knows why? Some of that could have been public pressure, could have been policy pressure, but that shifted, that language shifted in how they were representing themselves. And so we wanted to understand, okay, so now the food industry is saying they want to be part of the solution. What does that look like? Are they prioritizing things like health in their statements, or is it something that's just part of it, but it's not really a focus? And that's essentially what we found, was that health was something that came up. About 50% of the restaurants that we surveyed had some kind of a health-related position. But when we looked at the actual content of the statements on their corporate social responsibility web pages, we found that the majority of those statements were not health-related, as you said, about a quarter. And of those that were health-related, the majority of them weren't actionable things, so they weren't explicit. So you couldn't point to that initiative 5 years later and say, yes, they did what they said they were going to do. They were pretty vague statements like, we care about the health of our communities, for example, things like that.
We care. We're not going to do anything, but we care.
Right. It's something that we think about, but there isn't, a sodium reduction initiative, or we didn't find that many specific initiatives that we could say, okay, they actually did reduce the sodium content of their menus. And some of that could be a function of the restaurants that we included in our study. Some of it could be a function of the time frame that we were specifically looking at. So some restaurants did end up having some health-related initiatives. Like if you look at their web pages today, for example, McDonald's is a great example of a restaurant that actually does have some pretty explicit goals, especially for their children's menu. However, when we were looking, which was 2012 to 2018, those weren't necessarily explicitly put on their CSR pages.
What kind of restaurants were you looking at? Was it fast food? Was it chains?
It was 96 of the top 100 restaurants based on system-wide sales. So that includes quick service restaurants, fast food restaurants like a McDonald's or a Taco Bell. It also includes restaurants that are fast casual. So Chipotle falls into that, Panera or St. Louis Bread Company. I'm from St. Louis. So those sorts of restaurants that are kind of in between a sit-down and a fast food. Maybe they have some more fresh ingredients, things like that. And then also some sit-down restaurants too. So like the Chili's, the larger chain sit-down restaurants that you can think of.
Can you give me some examples of, and I hate to point people out, but who was really good and who was not?
Yeah, so interestingly, the restaurants that had the most statements, just in terms of number, were those that were coffee-focused chains. So think Starbucks and Tim Hortons. That was a little bit surprising. And I would say there's some other chains that you would sort of think of because maybe you've seen some of their initiatives. They're pretty good at advertising them. McDonald's is a great example of that. I think the ones that didn't do as well, I'm trying to think off the top of my head if there's anyone that stands out. It was surprising to me that of all of these chain restaurants, a lot of them did have some kind of corporate social responsibility. I didn't necessarily expect to see that per se, so I'll just say that was a surprise. Some of the initiatives that were happening were things like sodium reduction initiatives. Some of the restaurants had calorie labeling on their menus before it was required by law, so that was another example. Other initiatives included things like offering healthier sides or beverages, things like that, especially on kids' menus. But yeah, a lot of them were just, we care about the health of our communities.
Your study concluded that there's a need for more actionable health-focused initiatives in these social responsibility statements, particularly for chain restaurants. So devil's advocate, some would say it's not the restaurant's responsibility. It's personal responsibility. It's your responsibility to make the right choices. It's their responsibility to serve food that people want to eat. And I think we all know that what we want to eat and what we should eat can be very far apart sometimes.
Yeah, so I think it's a great question. I actually was thinking quite a bit about this. I think that it's fair to say that it's not the role of industry to be responsible for people's health. At the same time, we have companies publicly stating that that's something that they want to do. And, that to me indicated that there is this shift in how industry is talking about wanting to be part of the health of communities. And so if that is the case, what does that look like? And if corporate social responsibility is the way that companies are committing to health, I think it's important to understand how. Like, what does that mean? And is that something that we can look to as an indicator of this restaurant actually is offering me healthier options? Or is it as consumers? Or is it something where we have to be a little bit more, I guess careful might be the right word, of how much stake we put in those statements? And I think at least this initial study showed that there's not a lot of teeth to these corporate social responsibility statements, at least the ones that we looked at during the time that we looked at them. And so I think, as consumers, we can't just use that as like a rule of thumb when choosing where to eat out. But there's a lot of literature that suggests that people do use some of that information to make decisions about where to go to eat or what to eat, and that in some ways those could be a little bit misleading.
In the paper you mentioned public health initiatives kind of engaging with the industry. What might that look like?
There are some public health initiatives out there that have industry partnerships, and sometimes industry will partner with public health organizations as a way to be part of their corporate social responsibility initiatives. So one example is like the Partnership for Healthier America. They do a lot of public-private partnerships to try and improve food environments. And it's a great starting point. I think the point of this work isn't necessarily to vilify the industry. The point is just to point out where we can do more or where there might be gaps. And so I think that's really the biggest take home, is that there appears to be some gaps, at least in terms of what they say they care about and then the actual initiatives that are happening.
And so another study that you had come out just late last year was a look at restaurant choices, but it's from the patron side. Specifically, you looked at how parents' food choice values at home can influence their children's eating behaviors and choices in restaurants. Tell me a little bit more about this.
We were interested in understanding among frequent restaurant consumers. So this was done during the COVID-19 pandemic. And we wanted to know among frequent fast food consumers or restaurant consumers, how much did their restaurant eating change during the pandemic? And then we were also interested in, like you said, these parental food choice values and how that was related to both their children's eating behaviors in restaurants and around restaurant frequency of eating, and also just other characteristics. And these were specifically low-income families. And what we found was that, at least among these parents during this time, that there were 3 distinct classes or subgroups of parents based on their values. And we looked at things like convenience, cost, taste, sort of the big 3 that everyone thinks about when they think of food choices. But we also looked at things like nutrition, whether they wanted to support their local businesses, whether food safety concerns were something that they cared about. And what we found basically was that there were 3 different classes or groups of parents. There were parents, all 3 of whom prioritized convenience. And then the indulgent class of parents also prioritized taste. We had a hassle-free class or group of parents that prioritized not wanting to cook at home, which we've all been there. And then the multifaceted parent class also prioritize other things too. Like, they really value nutrition. They just had a lot of things that they thought were really important when they went out to eat at restaurants. And the most recent restaurant eating occasion, they prioritized all of those things, basically wanting to socialize with friends, et cetera. And essentially within these groups of parents, we saw differences in how their kids ate. So for the hassle-free group, those that prioritize convenience and not wanting to cook at home, they actually had kids that were more likely to choose a less healthy entree. And then for our parents that just really prioritized a lot of different things and had kind of values around almost everything with their restaurant eating, they were more likely to eat out more frequently. But they also had higher rates of food insecurity and lower rates of high stress.
You also found that children of parents who prioritize convenience and dislike cooking, as you said, they were significantly less likely to order healthy entrees when dining out compared to others. Did you get any idea why?
We don't know exactly why. It's a cross-sectional study, so we can't really say much about sort of underlying mechanisms or anything like that. But we could posit that there might be some other things underlying some of that. So there could be differences in food parenting practices. So that's another way of asking some of these same things. There could also be differences within these parent groups based on kids' taste preferences, what they're exposed to. It's possible that all of these parents had kids that were also not likely to order healthy entrees. So it's also possible that it's just a representation of the menu.
What kind of conclusions can we draw from this study? I mean, what does it tell us about our influence on our children's eating habits?
It's a great question. I think the conclusions from the study are that, at least from this context with this sample of parents, it seems that value systems have some relationship to child eating behavior. We don't know, again, if that's causally related because it's a cross-sectional study, but we can at least see that there are some observational differences in how these children are eating in the context of their parents' values. That being said, I think that there are other sort of bigger picture things to consider here, right? We have, again, low-income parents. during COVID. We all remember what that was like. It was incredibly stressful, especially if you're doing school at home while trying to work. And if you have a job where you actually have to be in the office, it's even more complicated. And so I think it was in some ways a unique time. That being said, we still have within this sample a fairly high rate of eating out. So on average about 2 times per week, which is less than they did prior to the pandemic. But considering that a lot of people shifted to not eating out at all, it's somewhat telling of the parents we were sampling. The fact that there is this higher rate of less healthy entree consumption among children whose parents are in that hassle-free group suggests that there's something that could be done at the restaurant level to reach those families. However, all 3 of the classes still had a high rate of choosing less healthy entrees, and in part that's a function of just what's available on restaurant menus. And so that goes back to some of these questions that we were talking about earlier about what is the role of the industry, et cetera, et cetera. My personal motivation for doing this work is that, there's a lot of reasons why families eat out. My family had to eat out a lot when I was a kid because I had 2 working parents and very active kids. And so that was just part of what we had to do as a family to make it. And in this group of parents, when you're experiencing low income, you are going to prioritize things that your kids will eat that might be cheaper in terms of calories per dollar. And so if you think, I can go get a burger from the dollar menu or I can get a pear, obviously you're going to choose the burger from the dollar menu. It's more satiating, it's more substantive, and that'll feed your child, right? And they'll eat it. And so given that, I think it's important to really consider what we can do in the public health setting to help empower families to just eat healthier when they do eat out. Like, you're going to go out to eat. How do we make it so that it's just easier to eat healthy when you eat out? And in part, that's maybe thinking about how restaurants can prioritize things like health when they say that's something that they want to prioritize, if that's something that they say they want to prioritize.
When we talk about those items that are less healthy, what do we mean by that? Those less healthy options?
Yeah, that's a great question. So we used a previously published study that had utilized data from a national survey where they categorized entrees as less healthy based on whether they were something like a burger, pizza, or a fried fish or fried chicken. Mm-hmm. So that's
the staple kids' diets.
Yeah, exactly. Yeah. And
unfortunately.
I know. And I can't remember if we were talking about this earlier or not, but I always joke that why in America is kids' food chicken fingers, grilled cheese, pizza, and burgers? Like, why is that what our kids eat, instead of a lot of other countries, even school meals, you see these beautiful pictures of these gorgeous school lunches that look like a full, complete meal. I mean, even here in Colorado, Boulder County does a lot of farm-to-school stuff. They have beautiful school lunches. It's very impressive what some schools can do if they have the resources. But for some reason, in the U.S., kids' food has just become the things that we see not only in restaurants, but, that are marketed to us on television shows, that we see in the grocery aisle. That's just what we're told is kids' food. And so I think that's something that, I hope that we as engaged citizens challenge a little bit. Why is that the only thing that's kid food? Why can't we also have a small version of grilled chicken or salmon or tofu even as a kid's meal?
I wanted to circle back. You had mentioned, again, that the study was done during the pandemic when people were less likely to go out to restaurants, and it also focused on low-income families in particular. Why focus on that time frame and that group specifically?
The motivation for the study was because I really wanted to understand in this group of parents and families how much did their restaurant eating behavior change during the pandemic. And it was a goal of mine to reach those families with some of my work doing intervention studies and things like that. And so I sort of had a panic moment when the pandemic happened because I've done all this work in the restaurant space. Like, are people even eating out anymore? Like, am I all of a sudden not doing something that's really meaningful? And so that was sort of like maybe a fear-based reason for studying this population. But it's also because it's an important population to study. Low-income families, as we see in our sample, experience a lot of stress. They have other stressors in their lives, like having food insecurity, access. The food environments in low-income communities are historically and currently not great.
You have several fast food places, but maybe not a grocery store.
Exactly. And you'll see this in the literature deemed a food swamp. And I think that's a pretty accurate term for it. So, and also these communities are disproportionately often marketed to by companies. And so that's another type of corporate social responsibility. Should we be marketing to historically marginalized communities?
The fact that a burger is $1 and a fruit or vegetable is also $1. The healthier options are often quite a bit more expensive. You go to a restaurant, the healthier choice costs extra. To add a salad is extra. To add or just to swap fries for a vegetable can be extra.
Yeah.
So it becomes harder to make those healthier choices.
Yeah, it can, especially if you're experiencing low income, definitely. I think what I've seen in my work is that, for a lot of restaurants, and not every child will order from the kids' menu, especially if they're older. But for a lot of restaurants, the children's menu is kind of a loss leader. Like, they're not making a ton of money on the kids' food, but they're making a lot of money on the whole family coming in. And so that's the goal, is to bring the whole family in, right? And so some of the restaurants that I've partnered with in the past have made those changes, like have automatically bundled their kids' entrees with healthier sides or beverages. And we've seen shifts in what children actually order. So this was some work that I did when I was at Tufts with the Silver Diner. So and from a business perspective, they actually continued to have revenue growth. They continued to make just as much money as other comparable restaurants. So I think that indicates that it didn't negatively hurt their bottom line, and we saw these positive shifts for kids. And so it can be done, in a regional chain, in a chain restaurant, and so I think that's just like a great business case study, essentially, of an example where it worked and it didn't really hurt their business, essentially. But that's also a diner, and they have fresh foods and they have the infrastructure to prepare the foods. So there's obviously unique challenges in certain types of restaurants.
Parents hearing this data, and myself included, I'll admit, they may hear all this and think, oh my gosh, I take my kids out to eat fairly frequently. I'm teaching them bad habits. I'm a bad parent. What should the parent takeaway be?
There's so many reasons why families need to eat out or want to eat out. And I think the last thing, at least that as a person I hope to do, is to contribute to the guilt that we all feel. And parenting is the hardest job. And I think you feel guilty all the time. And so I'm just speaking as a person now, but I think that's the last thing that I hope to do with this work. I hope what it does instead is just highlights how hard it is to navigate food environments anyway, especially in restaurants. I think it's just a challenge that we all have to deal with, unfortunately. And so hopefully that takes some of the pressure off us as individuals. It's just hard to navigate food environments for ourselves and also for our children. I think also I hope that it highlights instead what changes could happen that might help us. There's all these sort of subconscious things that we're exposed to on a daily basis that affect our choices, where products are placed, when we're marketed to, how we're marketed to, at what time of day we're making these choices. Are we stressed? Are we not stressed? All these things. And so I think just knowing that about ourselves, that context matters, environment matters, our mental state matters, our daily experience matters. and not to feel bad about the decisions that we make, but instead to know that like there's things that could happen that could make this easier. And so what are those things? Prioritizing some of those convenient, healthy things on the dollar menu, for example, could be one type of a change that a restaurant could make to make it just easier for families to eat a little bit healthier when they eat out, to market those healthier options, to provide more healthy options, to also make those things accessible and hopefully affordable for families, is something that hopefully is a shift that we start to see in the industry.
Thank you so much for your time. I really appreciate you being here.
Yeah, thank you so much. It was great to be here.
That was CSU Assistant Professor Megan Mueller talking about her research into the impacts of dining out. I'm your host, Stacey Nick, and you're listening to CSU's The Audit.